COVID-19 spreads very fast compared to many other diseases, but why is it so infectious? One reason is the location of the cells that the virus often first infects. The goblet cells in the nose can be easily infected by the coronavirus, and so can the ciliated cells. These cells produce and transport mucus. They contain two types of receptor protein that the coronavirus needs to attach itself to. As these cells are in the nose, it's far easier to breathe the virus in and out. People can pass COVID-19 on without showing symptoms. Many people with the disease won't know they have it. This asymptomatic transmission makes it very easy for the coronavirus to spread. COVID-19's incubation period is relatively long. People with seasonal flu usually start to feel unwell up to 5 days after infection. In contrast, COVID-19 symptoms often show after 5 or 6 days, but can take 2 weeks to appear. The infectious period for seasonal flu is also shorter and lasts for about a week on average. COVID-19 is usually infectious for 8 to 10 days, but it can be for much longer, especially in more severe cases. This longer infectious period is one reason why COVID-19 has spread so easily. More than 1 million people have died from the disease globally. The SARS and MERS outbreaks were also caused by coronaviruses. They killed far fewer people overall, but carried a much higher chance of death. A lower fatality rate actually helps COVID-19 to spread. People are more likely to carry the disease around without needing to go to hospital. This means there's more chance of passing it on to someone who's vulnerable. Scientists are keeping a close eye on how the virus is changing. Hundreds of mutations have been spotted. One of these, D614G, appears to have made the virus more infectious. By the end of June, the mutation was found in almost all samples worldwide. The coronavirus appears to be mutating slower than seasonal flu, but over time, could further changes make it even more infectious?